the brain is similar for patients with autism or schizophrenia. So this clinical study is small number, maybe 41 participants.
Okay.
So later we'll try to conduct another clinical trial on dementia. Yeah, more people. Maybe we need 200 people. I lost my father with terminal cancer. I was in huge shock. I couldn't work for 6 months. Children are genius. True genius can be born with autism. Maybe immune modulator. Immunoglobulin is good, but GcMAF is totally different.
Hello, everyone. I have with me Dr. Toshihime from Japan. He's a cancer specialist and physician. He is also leading a team of researchers, and he is CEO of the clinic Saisei Mirai. Hello, Dr. Toshihime.
I'm Toshihime, and it's a pleasure to be here to talk to you. Thank you.
Thank you so much, Dr. Toshihime, for giving us this interview today. Before we talk about the GcMAF,
Yes.
The main subject of
Yes.
this interview, please tell us who are you as a doctor and as a person, and what experiences made you to pursue an idea that maybe challenges conventional medicine.
Right. I'll answer your question. More than 20 years ago, I lost my father with terminal stomach cancer.
Stomach cancer.
Plus, I lost my cousins, family members with cancer. Especially when I lost my father with terminal cancer, I was in huge shock. I couldn't work for 6 months. Then I decided to be a special cancer doctor developing new cancer immunotherapy.
Okay.
Yeah. And then I started working again.
So your father was the main
Main lead,
character, yeah,
That's right. Yeah.
who made you pursue
That's
this
right.
this
That's
career.
right. Yeah, that's right. Yeah.
Please tell us, for someone who has never heard of GcMAF, how would you explain it?
Okay.
And what happens in the body when you first introduce it?
So GcMAF is a natural substance existing in our body. When our body has inflammation, then GcMAF can be produced naturally in the bloodstream. Yeah, GcMAF can, in the old term, activate but stimulate macrophages.
Okay. So is it normally found in the bodies or
Yes, for short time.
for a short time?
Yes.
And what happens when we introduce it? What's the main role of GcMAF?
Main role is to stimulate macrophages. And then macrophages can change their polarization from M1 to M2 or M2 type to M1 type.
Okay.
Yeah. So macrophages can work requested as our body. Yeah, body is necessity. Yeah.
So that works for microglia, I guess,
Yes.
as well.
Yes.
It's the same
Yes.
action.
Yes. There are two types of macrophages in the body.
Yes.
One is circulating monocytes in the blood.
Yes.
The other is tissue-resident macrophages in the body, including microglia in the brain. Yeah.
Please tell us, are there any blood tests or any biomarkers that can demonstrate changes before and after GcMAF?
So actually, this is a little bit difficult. We know what is macrophage and how it works, but the function is very difficult. We know for all the genes existing in our body, but we can't make clear the function of each immune cell. Yeah. We can identify macrophages or T cells or B cells, helper T cells, killer T cells, but the function is very difficult to measure accurately. Yeah.
But how would you measure the inflammation, for example, in the body? Are there any biomarkers like TNF-alpha or interleukin?
Yes. TNF-alpha, interleukin-1 beta, interleukin-6, interleukin-4. Yeah, and other biomarkers are ferritin,
Okay.
CRP, and ESR. Yeah,
Okay.
Yeah.
And during your studies, did you see any changes in these inflammatory markers?
Yes.
Obviously, after use of GcMAF.
That's right. So, especially we used dietary math for mouse experiment.
Yeah.
Mouse experiment with LPS.
Yes.
Increased TNF-alpha, interleukin-1 beta, all decreased nearly half.
Because why I'm specifically interested in this, because obviously it's my son who's presenting all these biomarkers who are very elevated. And I was curious maybe to show the public. You've shown me some paper earlier on regarding some changes in TNF-alpha, I guess. Is
TNF-alpha, that's right. Oh,
this one, yeah.
So this one.
So this is using oral MAF.
Oral MAF, yes.
Oral MAF. So we're expecting with the use of GcMAF, the inflammatory markers to reduce even more, isn't it?
That's right. Yeah.
Okay. So in here, in your case study, we have a decrease in TNF-alpha levels of 54%.
That's right.
And 1 beta levels, that's a decrease to 10%.
That's right.
So that's a decrease of 90% actually.
That's right.
Amazing results,
Yeah.
I've read something about Nagalase.
Nagalase, okay.
What's the role of Nagalase and how does GcMAF works in terms of that?
Okay. There are two types of Nagalase. Endotype Nagalase and X-type Nagalase. Dr. Yamamoto's theory depends on endotype Nagalase. Yeah. And endotype Nagalase can be produced from virus-infected cells and cancer cells, but not normal cells. But X-type Nagalase can be produced from cancer cells, virus-infected cells, and normal cells. And if we can measure endotype Nagalase, then it is pretty good. But X-type Nagalase is not so accurate. But still, it's a type of inflammatory markers. Yeah.
So we would see an increase when the body is fighting all this
decrease
after using GcMAF.
Yes.
But before you would see an increased Nagalase.
Yeah, high Nagalase levels in the blood. That's right. Yeah.
Okay. Okay. Thank you.
Yeah.
In terms of these measurements, which ones you consider the most important, or it's hard to say?
Yeah, that's right. Inflammatory markers maybe TNF-alpha, interleukin-1 beta, interleukin-6, interleukin-4. Yeah.
What about S100B? We use it a lot in our country in terms of neurological inflammation. What do you?
Okay, neurological inflammation. It is okay to measure from the blood, but in the brain, there is good blood-brain barrier. Yeah, sometimes it might be difficult to measure, but still we need several markers. So that is also good because we can't check inside of the brain. Yeah, especially inside of the blood-brain barrier. Yeah.
So I guess we only see these markers elevated when the barrier, the hematoencephalic barrier, is kind of opened, isn't it? And it's
going down.
Yeah.
Like NSE.
NSE
is one type of cancer markers, but still it is up for autistic children or neuroinflammation.
Exactly. Yeah. Going further. What type of patients did you treat with GcMAF?
Okay.
What were your findings? And where did you find that you have some limitations?
So I'm a clinician, so I have been treating many patients with GcMAF, for example, cancer, autism, Lyme disease,
Lyme disease.
common cold,
Yeah.
atypical mycobacteriosis,
Okay.
and pneumonia.
Pneumonia.
Yeah, and autoimmune diseases.
Like
Rheumatoid arthritis, SLE, Sjögren syndrome. Many.
Which syndrome? Sorry.
Sjögren syndrome.
That's something I've never heard about.
Okay. A special type of autoimmune disease. In this case, it's very effective.
Yeah.
And plus, leaky gut syndrome.
Leaky gut syndrome,
yes.
Which is very common actually in autistic children as well.
That's right. Yeah. Autoimmune condition in the gut.
So this type of diagnostic, you treated them mainly with oral MAF. And what about GcMAF? Did you find that it has an increased response, or is the response better to GcMAF injection?
Generally reduce inflammatory markers. But maybe for the gut, leaky gut, maybe oral MAF is a little bit better than GcMAF injection. Yeah.
Because of its form, I understand it comes in a special form of capsule, is it?
The capsule, yes, an acid-resistant capsule, and oral MAF is designed to go into the intestine directly. Yeah.
So it's going exactly down the way
That's
it needs to.
If we take powder, then it would be digested in the stomach.
Yes.
Oral MAF is a food product in Japan. Just a food.
Okay.
Yeah.
So it can oral MAF be used without a prescription?
Yes, it is easy.
Okay.
Like whey protein. In Japan, every people buy whey protein and oral MAF.
Okay.
Yeah. But in other countries, it is a dietary supplement.
A dietary supplement.
Yeah.
And during your studies and during your, because I understand you have more than 40 years since you're being a physician and working with this type of patients, where did you find that there are some limitations? Are there any diagnostics you can't treat or you've never treated? For example, Parkinson.
Okay.
Have you ever treated a Parkinson patient?
Not so many. Small number of patients. Parkinson's disease. Yeah, and other rare diseases, but difficult diseases. Yeah.
They're very complex.
Yeah. And we could do a clinical trial on Parkinson's disease using oral GcMAF injection, but I need to think about one more time. Yeah, because we need mouse experiment and then clinical trial. Yeah. I'm a clinician, so I think it is important to get clinical facts. I'll carry clinical facts to my friend, basic researcher, and then I ask them to do mouse experiment, and then after that, clinical trials. Yeah.
Understand.
Yeah.
Understand.
Yeah.
But you did have some patients with dementia, isn't it?
Dementia, yes.
And you've seen an increase in the cognitive function, I understand.
Cognitive function, yes.
Yeah.
That's right.
Show me some papers. Can you show to the camera? Because obviously it's hard to put people to look for all this data.
That's right.
So this is kind of a score which shows the cognitive function in dementia people, isn't?
MCIS score. And this clinical study is small number, maybe 41 participants.
Okay.
So later we'll try to conduct another clinical trial on dementia. Yeah, more people. Maybe we need 200 people. Yeah, and we can use more MAF. We use just 2 tablets of MAF triple per day.
Only with oral MAF, no injections.
No injection.
Only oral MAF.
Maybe 3 tablets per day or 4 tablets per day would be better. Yeah.
So between 2 and 4 tablets, depending obviously on their condition.
Right. That's right.
Okay.
Right? Yeah.
Thank you.
Yeah.
I did ask you this for my son as well.
Yes.
Is it something similar to immunoglobulin, or do you see GcMAF as an immunomodulating treatment? And what changes in the immune system you're trying to achieve when you're actually giving this treatment to your patients?
So maybe immune modulator. Immunoglobulin is good, but GcMAF is totally different. GcMAF can adjust immune system to function, immune cell to function, and especially showed rejuvenating immune cells, because dietary map showed telomere extension using white blood cells.
White blood cells.
Yes, lymphocyte, neutrophils, and monocyte.
Yeah.
Their telomere was extended by 23% in 6 months after starting MAF 2 tablets a day.
In 6 months, oral MAF.
Yes, 23%. This is pretty good.
Yes, They're amazing results.
That's right. Yeah. And I have a data.
You have that as well.
Data. Yeah, that's right.
This is something that I haven't seen yet.
Okay. Yes. Right. This is mouse model. So in mouse model, telomere length was extended. Yeah, plus 54%.
In 6 months time.
In 1 month.
1 month.
In 1 month, maybe 1 month. It's 4 weeks.
Oh, 4 weeks.
This is mouse and telomerase TAT and TAC also increase.
So what's the difference between this marker and these ones? This is something new for me. I don't really know.
Okay, telomerase can support telomere length, especially a little bit high telomerase can maintain telomere length, because telomere length is getting shorter and shorter.
Okay.
It's like in Japanese, inochi no kaisu, meaning life chicken.
So it's like it's a marker to it's a longevity marker.
Longevity marker. When we are young, telomere is long.
Yeah.
Then telomere
Gets shorter.
Getting shorter. Yes, that's right. Yeah.
So you found that this marker has expanded its
yes. This is a mouse experiment, but this one not another mouse. This one, sorry. In fact, not all. That's right. This one. Phase 2 clinical trial conducted in Japan.
Yes.
Yeah. And also,
so in here, so that was the animal model, mice model, and this is a clinical study in people.
People, yes.
So in here, there is expanded in 3 months by 12%.
Yes, that's right.
And 6 months by 23%.
23%, that's right, on average. Average.
Only in 6 months.
And only MAF 2 tablets are there. Right.
So maybe if you're using longer, we're getting to 100%.
Yeah.
We stay younger forever.
That's right, forever. That's right, forever.
Now going into a subject which is, it's me who's mainly concerned about that because of my son, obviously, who's been diagnosed with autism and pandas. Or we'll see if it's only pandas and the autism is going away. But can you tell us your findings or outcomes in treating patients with autism?
Autism, yes.
If you ever treated patients with pandas,
yes.
And is there any evidence that you still think is needed in terms of treating these patients, or
so,
what's your opinion on that?
So autism spectrum disorder, it's not a single condition. And once I planned to conduct a clinical trial on autism, but it was difficult. But I'm planning to conduct clinical trial on autism using oral map.
Yes.
Yeah. So in Japan, it is not so difficult. I have lots of friends in Japan. who has been taking care of autistic children. Because the number of autistic children is increasing.
Yes, yeah.
So quickly. Usually,
it's like an
15% epidemic, but I think pandemic. Pandemic, in the world. Yeah, that's right. Yeah.
So you have treated patients with oral MAF, this kind of patients, isn't? What were your findings? Like, what changes did you see in these patients?
Yes, usually, for maybe several years, autistic children, we can find out some improvement in 3 to 4 weeks. So for small children, the response to GcMAF is pretty quick. GcMAF or oral MAF, the response is pretty quick. But if the patient is more than 10 years old, the response to GcMAF is a little bit.
It takes longer to see a response. And what I guess the parents are the ones who are noticing the most changes.
That's right.
So what change? Did they see any changes in speech or inflammatory markers, or where can you point exactly?
Okay. Initially, understanding, eye contact, they are getting better. Speech takes some time, but understanding, eye contact, then they want to start something new. Yes.
So they're more active, more involved in activities.
That's right. Active,
yeah. I guess that means they're more receptive as well.
That's right. That's right.
Overall, it's improving their mental state.
Yeah, and autistic children are genius. True genius can be born with autism. Yeah, so my purpose is to maintain their talent, but we need to increase social skills.
Yes.
As I told you, I have 3 daughters, and 2 daughters were autistic.
Yes.
In the past, GcMAF was not available.
Are your daughters using GcMAF? Or?
Right now. When she became 25 years old, I started GcMAF. And recently...
At 25 years old?
Yes.
Not when she was very little, like mine, or...
That's right. So, 25 years. Usually, the brain is complete when children become 20 years old.
Yes.
So, 25, the results are good, but not good enough, not perfect. So, 3 weeks ago, I started treating my eldest daughter with GcMAF injection.
So you're still you're curious to see how it works in your in your daughter who's actually not elderly, but
for autistic adult and plus schizophrenia. The brain is similar in terms of
synapses.
Too many synapses. So the brain is similar for patients with autism or schizophrenia. So I have some friends, and one friend had schizophrenia patient, but the patient was diagnosed autism, and then he has been taking strong medications for many years, and then more than 15 years, the diagnosis was changed
to schizophrenia. So
Mm.
is that something common? The autism diagnosis is changing into some kind of schizophrenia, or it was just a...
I know only 3 people. Yeah, autism diagnosed autism was changed into schizophrenia.
Okay. I guess because of many autistic children are actually put on antipsychotics medications since they're little. So those medications are used in common.
So I hope I can help patients with schizophrenia. Yeah, in their 20s or 30s.
By using oral for GcMAF.
But they tend to take strong medication. Yeah. Then strong medications can change their personality, character.
Yes, yeah. we discussed mainly you have used oral MAF
Yes.
and also GcMAF injections.
Yes.
Can you tell us what's the difference between oral and GcMAF injection?
Okay. So the number one is to combine both GcMAF injection and oral MAF.
So that would be the best way to treat a patient.
But initially, increased hyperactivity could happen.
Yeah.
In the beginning of GcMAF immunotherapy. So, but later, I mean, in a couple of months, if it is necessary, I can add oral MAF. Usually for small children, they can't swallow the capsules.
Yes.
And the powder is a little bit difficult. So maybe injection and then oral MAF.
Okay. And in terms of biochemistry, what is oral MAF made of? Because with GcMAF injection is pretty simple. We understand it's a blood prop that it's made from a protein from the parent's blood, and which it has some enzymes added. But in terms of oral MAF, what is it made of? Like
okay. Usually we have been producing GcMAF injection for many years. And my thinking, I like
new ideas.
The theory, new ideas.
Or to think out of the box.
Evolution.
Yes.
Evolution. And then sometimes colostrum. Then the cow's mother produced babies. Initially, sometimes the color of colostrum is red color. And the blood and colostrum
very similar.
Very similar. And then I decided to produce colostrum.
So oral MAF is basically made out of colostrum.
Yes, milk. But then we produced whey protein. Because of regulation in Japan, it was difficult to produce colostrum.
Yes.
And then we changed whey MAF. But the whey MAF is a little bit better than colostrum. Because for GcMAF, we don't need IgG, immunoglobulin.
Yes.
Oh, that is fine. Yeah. But we conducted clinical trial on COVID-19 in Ukraine.
So this was on patients.
Both.
On patients.
Yes. So control, but colostrum MAF and whey MAF.
So basically, with these are a type of patients who haven't used MAF.
That's right.
These are patients who used
whey MAF.
And this is triple MAF or
yes, colostrum MAF, but triple MAF. Yes.
Yeah. So the rate of that's mortality rate. Yeah. So the rate has decreased from 8% to nearly 2% or even less than 2% in 14 days.
Yes, that's right.
That's amazing result.
9 tablets per day.
9 tablets per day.
Yes.
So that was more like a shock dose.
That's right.
If someone is watching this interview and is interested in GcMAF,
yes,
what should they do before considering it? And how does a typical treatment course looks like in terms of dose, frequency, and duration?
Yes. So now I'm making some protocol on autism and other diseases.
Yes.
Because it's difficult to understand for many people. Yeah. And then plus, GcMAF is effective for a very wide variety of diseases. That is why. Yeah. And I need to explain more on autism. Yeah, but my problem is I don't have enough time. So I'm planning to make a podcast. To explain everything.
Oh, that's great. So we should look for that podcast. So I guess every patient is different. They have their particularities, and it's hard to say this is the plan of treatment and it works for every patient. But in terms of oral MAF, which is a dietary supplement and can be bought by patients, do they need a medic supervision or they can start buying it and taking it by themselves? I'm more interested in in the patients from my country, for example, because in Japan, oral MAF is a known treatment, but not so much in my country. So if they want to start taking this treatment, do they need a medic supervision, or they can go in the pharmacy and buy this treatment?
So dietary supplement, okay. So each patient has different response to GcMAF. So I need to explain more. And then it might be okay. Yeah.
So you would say maybe a consultation with the medic first and then go and buy it.
Yeah. Or maybe some specialist in England.
England, yeah, because we live in England, but obviously we're doing this interview for Romanian people as well, and for everyone who's watching. Do you have any medics you're working with in Romania or in England where they can go and basically have the access to this treatment easier than coming to Japan? Or...
I have doctor friends in England and Romania.
Yes.
And next week, my doctor friend will come to Japan from Cluj.
From Cluj.
Cluj, yes.
And that is Dr. Fior Mureșanu, isn't?
Yes, that's right.
And England, do you work with a medic from England who can facilitate the access to this treatment?
Dr. Ari.
Ari.
Dr. Ari, yes.
We'll research and we'll put the name in there. And he is the one who can actually facilitate the access to this treatment, isn't?
And yes, yeah. But I have never visited England before. So,
you've never been? Maybe you come and visit us.
Yeah. And honestly, I need a specialist like you. Then you can talk with many people explaining GcMAF. My time is limited. That is why I determined to write protocol plus podcast. But I need a specialist like you. Yeah.
Unfortunately, I'm not a specialist. I'm just a nurse.
But you can be a very specialist.
I can be.
Yeah.
I'll become a specialist for my son, and then I will recommend it maybe to the other patients. Thank you, Dr.
Because I hope I can help many autistic children and cancer patients. Yeah.
I think that's our wish as well. That's why we're doing this with this interview, hoping that we can share more information and make this treatment more accessible to patients all over the world.
That's right.
So I think I have one last question, Dr. Iulie, if you don't mind.
I don't mind. Okay.
Because you're leading the clinics, GcMAF, and I understand you've got a few clinics in other countries, not only Japan. But for GcMAF injections, people need to travel to Japan, isn't?
Yeah, that's right. So, if we can have a clinic in Romania or England, and then if it is okay to produce GcMAF, it would be number one method. Number one plan, but medical regulations are difficult.
It's a lot of legislation and regulations.
That's right. Especially blood products. Oral MAF is not difficult. And then we are producing recombinant MAF.
The recombinant MAF, which is a product made of what?
Made from plant cells. Or CHO cells.
Okay, that's something new.
And it will be available in a couple of years.
In a couple of years, so you're still researching on that.
Yeah. We produced, and then we started mouse experiments. And recombinant MAF is different from our dietary MAF or GcMAF injection. It can change M2 macrophages into M1.
Into what?
M1 type.
Oh, M1 type. They're changing the state of the macrophages from M2, which from M1, which is the inflammation state, into M2, which is the relaxed state.
Lung fibrosis from M2 to M1 might be necessary, but still we need to do more mouse experiment and then human clinical trial. And another one, CHO cells. This can be a medication. This is the same as first generation GcMAF. So we have 4 types of GcMAF.
Okay.
First generation GcMAF.
Yes.
second generation GcMAF, and the third generation GcMAF, and then now fourth generation GcMAF.
And obviously, with every generation, there are improvements, and you see.
That's right. Right now, the second
different results.
generation GcMAF injection, this is good. And the third generation, dietary MAF, oral MAF, and this is also good. But recombinant MAF are a little bit different. Yeah. Yes.
So, do you plan to expand internationally and make?
Yes.
You plan to
Yes,
expand internationally.
that's
We're,
right.
we're waiting for your clinics then in
Okay.
England and Romania.
Yes.
Maybe we don't need to travel. Although we really enjoyed the
Yes.
visit in Japan.
Yeah.
Maybe other parents don't need to travel to Japan to be able to access this treatment.
Yeah.
And tell us, as a last question,
Yes.
please, what does Saisei Mirai mean to you?
Okay. Usually, Saisei means rejuvenation.
Rejuvenation.
Mirai means future. So
future of the
future. So I have decided to produce many good immunotherapy to destroy cancer, to help people with other diseases. That is my purpose. So number one, to destroy cancer. The word destroy is not adequate, but yes.
Thank you so much, Dr. Remy. Thank you so much for all this interview and the valuable information. I hope it was useful for you, and thank you again. I wish you all the best with your researches, and obviously you'll have an update from us soon regarding our son. Thank you so much.
Thank you.